start by checking your posture is upright, respiratory assessment, and I can see that your posture is upright. No distress noted, and there's no nasal flaring. Have no distress noted. I see that your skin is warm, and I see that your skin is warm. I'm going to have you put your thumbs together, and I'm going to check for clubbing. I'm going to have you put your thumbs together, and I'm going to check for clubbing, which is good. I notice that then I'm going to check your conjunctiva, and then I'm going to so I'm going to have you check down your eyelid, and I see that it's pink. So I'm going to have you pull down on your eyelid, and I see that it's pink, and that's good. I'm going to check your trachea, which is midline. I'm going to check your trachea, which is midline, which are pink. I'm going to check your capillary which are pink, which is good. Capillary and I also noticed that you don't have any intercostal. I also noticed that you don't have any intercostal. I'm going to check your rate retraction for a minute. I'm going to check your rate for a minute, and I noticed that it's 20, which is and I noticed that good, it's 20, nice easy which breathing. Is good, and I noticed that you had nice easy breathing. I'm going to compare your chest. I'm going to check the anterior to the posterior. So looking, I see that it's 2 to 1, which is good. So from there, I'm going to have you turn, and I'm going to palpate your back, and I'm going to stop up here at the apex and just work my way down, and I don't feel any tumors or crepitus. And do you feel any tenderness?
No.
Okay, good. Now check for your thoracic expansion, which is at the T10. So I'm going to have you inhale and then exhale, and I have equal movement, which is good. The next thing I'm going to have you do is the tactile fremitus. So I'm going to have you say 99, and I feel with my hands, I'm going to have you say 99.
99, 99, 99, 99, 99, 99, 99, 99.
So that's good. From the apex to the base of the lungs, the tactile fremitus decreases, and that's what we want to see. So then I'm going to check for percussion. So tap on my middle finger, and I'm going to ask that you give yourself a bear hug while I do this. And I'm checking for renaissance throughout your lung. And I noticed that there's renaissance throughout your lung. The thing I'm going to do is check for diaphragmatic excursion. I'm going to have you take a deep breath and let it out all the way, and then hold your exhale, and I'm going to percuss. And I feel dullness right here, so I'm going to get a piece of tape. And then I'm going to percuss again till I hear dullness, but I'm going to have you take a deep breath and hold it this time. Okay. I'm going to put another piece of tape, and I'm going to measure. And I have 5 centimeters, which is good. Anywhere from 3 to 5 is good. So, your lungs, I'm going to auscultate the posterior, anterior, and lateral. So I'm going to have you breathe in and out through your mouth, and just let me know if you're having any lightheadedness or dizziness, and I will stop. So, breathe in and out. In and out. Good. Lung sounds are good. I'm going to have you turn, and I'm going to listen over your manubrium and listen to your bronchial sound. And good. And then I'm going to listen over your trachea, and I'm going to have you take a deep breath. Oh, that's very loud. So your bronchial sound was loud, but your trachea was very loud. I'm going to start by examining your cardiovascular system, and I'm going to start with your suprasternal notch, which is here. I'm going to slide right up, which is your clavicle, and and about an inch down is your second intercostal space, and in between is your first rib, which is hidden. And then from there, I'm going to feel your aortic space, which is in between. It's on your right second intercostal space. Slide over to the left second intercostal space, and that's your pulmonic. I'm going to slide down to your third intercostal space, and that's your herbs. And then your fourth intercostal space is your tricuspid, and underneath, under your fifth intercostal space is your mitral. Listen using my diaphragm on my stethoscope, and I'm going to listen to the same areas: your aortic, pulmonic, herbs, tricuspid, mitral, and apical. And I hear that your S1 is louder in the aortic and pulmonic, and your S2 is louder in the pulmonic and aortic, and your S1 is louder in the mitral and right tricuspid. And we use the diaphragm for high-pitched sounds. Next, I'm going to do it again with the bell to listen to low-pitched sounds in the same area: aortic, pulmonic, herbs, tricuspid, mitral and apical. And your herbs point, S1 and S2 are equal, and your S4 lub is louder, and your apical and mitral lub are louder, and there's no S3 or S4 murmur noted. You lay down, and I'm just going to check for lifting or heaving in your aortic, mitral, apical, or jugular area, and I don't see any lifting or heaving. I'm going to have you turn your head to the right, and I'm going to feel your jugular vein, and I don't see, and I don't feel any pulsation or any distension noted. Next, I'm going to feel your aortic, your pulmonic, your herbs, tricuspid, and mitral, apical, and I don't feel any distension. Then I'm going to palpate your aortic, pulmonic, herbs, tricuspid, mitral, apical, and I don't notice any vibration, so that means you don't have any turbulent blood flow or murmur noted. Return to your left side, and I'm going to check your tricuspid area for S3 or S4 mitral tricuspid murmur. And I'm going to check first with the diaphragm. And then I'm going to check with the bell. And no S3 or S4 was noted in the aortic or pulmonary murmur was noted. Okay. And I'm going to check, if this brings out your aortic and pulmonic murmur, if you have any. So I'm going to listen with my diaphragm first. I'm going to have you lean forward. And now I'm going to check with the bell. And no murmurs were noted. Looking for peripheral pulses, so I'm going to have you come right here. And I'm going to start off with your temporal artery, which is +2. I'm going to check your carotids one at a time, +2, +2. I'm going to have you extend your arm forward, and I'm checking your brachial, +2, radial, +2, ulnar, +2. I'm going to, as I'm looking down, I see that your hair is evenly distributed, no edema, and your skin is nice, warm, and intact. And I'm going to check your popliteal, which is +2, and I'm going to, are you okay? I'm going to check your dorsal pedis, which is +2, and your posterior tibia, which is +2. Then I'm going to do the Allen test. So I'm going to actually put one finger on the radial and ulnar pulse, and I'm going to have you close your fist And I'm going to have you open your fist, and I'm going to release on the ulnar, and as you can see, your hand is filling up and it's nice and pink, so that's good blood flow. And I'm all done. So now I'm going to check your apical pulse for a minute, and it's 68, which is good. And I'm going to check your blood pressure in your right arm. (114/70). I'm going to check on your left. And that was 116/70.